So, welcome. At this moment I am talking with Frans Vosman. Can you introduce yourself briefly?
Yes, as you said, Frans Vosman. I'm 61 years old and I'm teaching the ethics of care here at the University of Humanistic Studies. I started to teach the ethics of care 2007, so for over the past few years this is really my domain, together with other colleagues, to teach and to do research on the ethics of care.
Okay, thank you. At the conference you gave a speech about approaching care as within practice. Can you explain what you mean with that?
Yes. So, according to me, it's very important to think about care, but take a position within practices of care. And so to say, to look bottom up, you could easily talk about care from the position of a government or from a philosopher who thinks about care from a distance. But to my mind, it's far more interesting to step into the practices, or people within the practices start moving and start reflecting about what is care and what makes care into good care. And so in that sense, the reflection has to be next to the practitioners. And when I talk about a practice, it's not just about professional practice, although that's very important, of course, of care within institutions and for instance a hospital or a nursing home or something like that. But caring practices are everywhere, so there are caring practices within the home, within the family, but you could find practices everywhere. Also, for instance, among an association of people who swim together. So it's not limited to healthcare or welfare in the formal sense of the word.
Education as well?
Oh yes, very much so. In fact, there's a lot of interest within the education for the ethics of care. Yes.
Okay. In what kind of front do you see that for the education?
Well, there are. Then we have to talk about the parallels in healthcare, welfare organizations on the one hand, with schools, universities on the other hand. There's a lot of parallel there, and so also a lot of enthusiasm, so to say, within schools to think about what education really is, as there is enthusiasm in care institutions to rethink about what is caring about, really about. A parallel, for instance, is the big distance between physician, nurse, and patient on the one hand. You have this influence of an organization that puts doctors and nurses on one side, and the other side there is this patient and the relatives. So something similar is going on in education. There's a huge gap between teaching personnel, management of the schools on the one hand, and young students, young pupils on the other hand. So that you could say, where is the community within care institutions, and where's the community in the school? And that's just one of the parallels where you see people that are in schools be very curious what is going on in the ethics of care.
Okay.
So the lack of community. But there are far more parallels. Yes.
So it's not only limited to the healthcare ethics of care?
No, not at all. Not at all.
Okay. Yeah.
We within our own research concentrate on healthcare and welfare. But there are also people within the research group that do the research with regard to schools, just a teacher in a school, for instance.
Yeah.
So our main emphasis is indeed on the one side, but we could easily hop over to the other domains.
Yeah, okay. And a final question for me now is, how do you see the future for ethics of care? Is it a good future, or do you have some overthinkings about that, if it's going to be all right?
Well, I think there is an agenda for the ethics of care, and it is to develop the political ethical character of it, so that we really can look at all these questions: what is good caring about, what is good education, from a political ethical perspective. Not from a pragmatic one, not from a psychological one, but from a political ethical one. And so I have great hopes with regard to that agenda, that we will be able, with many other people inside these organizations and together with movements of citizens, to really rethink what is good care in the broad sense of the word. So if I look at that agenda, I'm really very hopeful and very positive.
Okay, thank you very much.
Thank you.